What does the TB skin test, TST, tell you about TB? Imagine a tiny skin bump that can reveal a lot about your health. The tuberculosis skin test, also called the tuberculin skin test, or TST, is a simple way to check if you've been exposed to the bacteria that cause tuberculosis. It works by injecting a small amount of purified protein derivative, or PPD, just under the skin on your forearm. This PPD is a substance made from parts of the bacteria called Mycobacterium tuberculosis. If your immune system has seen this bacteria before, it will recognize the PPD and react. After about 48 to 72 hours, a healthcare professional will look at the injection site. They measure the size of the raised, hardened area called induration in millimeters. The size of this bump helps determine if the test is positive or negative. But what counts as positive depends on your risk factors. For example, if you have a high risk of TB exposure, like being HIV positive or recently in contact with someone with active TB, a bump of 5 millimeters or more is considered positive. If you are at moderate risk, such as recent immigrants from countries where TB is common or injection drug users, then 10 millimeters or more indicates a positive result. For people with no known risk factors, a bump of 15 millimeters or more is needed for a positive reading. It's important to remember that a positive TST means your immune system has been exposed to TB bacteria at some point. However, it does not tell you if you currently have active tuberculosis disease or if the bacteria are dormant in your body. To find out if you have active TB, doctors will usually order additional tests like chest X-rays and sputum tests. These help determine if the bacteria are causing illness or just lying dormant, which is called latent TB infection. A negative TST generally suggests you haven't been infected with TB bacteria. But sometimes, the test can give false negatives. This can happen if you were recently exposed, especially within the past 8 to 10 weeks, or if your immune system is weakened. Young children, people with immune suppression, or those who recently received certain live virus vaccines might also have false negative results. On the other hand, false positives can occur if you've had the BCG vaccination, which is common in some countries, or if you're infected with other types of mycobacteria that are not TB. Sometimes, healthcare providers use a two-step testing process. If your first test is negative but you are at ongoing risk, they might do a second test a few weeks later. This helps catch people whose immune response might have waned over time, preventing missed infections. In summary, the TB skin test is a useful tool to see if your immune system has been exposed to TB bacteria. It helps identify people who might need further testing and treatment. But it is just one part of the bigger picture. Always consult a healthcare professional for interpretation of results and to understand what they mean for your health. Remember, knowing your status is the first step towards staying healthy and preventing the spread of tuberculosis.